So we're here at the Global Health Exhibition in Riyadh, continuing the discussions surrounding the future of healthcare. Now, in addition to the technological innovations, there's also a conversation about resilience of Saudi Arabia's healthcare industry. And to understand that a bit more, we're very kindly joined by engineer Mohamed Sindi from Philips, CEO of Philips Saudi Arabia. Thank you for joining us. I'm liking the stand. It's pretty huge over here, and there's a lot of focus on the resilience of Saudi Arabia's healthcare system. How is Philips discussing that over here and showcasing at this grand event?
Yeah, thanks for that. I think for Philips, we exist in Saudi for more than 85 years now. I think this is a long journey, providing the latest innovation in a lot of areas. But if we talk about the last 5-6 years, I think in Saudi we become more focusing on the health tech solutions, so supporting the kingdom in realizing the Vision 2030 goals, and also helping in transforming the healthcare system. It's not only with the government, but also we are trying to help the private sector in order to be ready with their expansions, with their transformations, in order to be ready also to participate in the Vision 2030.
In terms of the technology that we can see today, we've got acute care, we've got the early warning scoring as well. Talk to us about what's been on showcase at the Philips stand that is really contributing towards enhanced learning in this industry.
Absolutely. So all our solutions that you see it in the background is basically built around the 4 quadruple aim. So the quadruple aim basically is about 4 elements. One is about patient experience, staff experience, improving the healthcare, quality, and also reducing the operation cost. So we see, for example, a lot of issues around healthcare accessibility. So we see, for example, in Saudi, the large geographic area, a lot of challenges to access healthcare in some very, very remote areas. Also, we see the scarcity of the very intensive, specialized healthcare practitioners around the world. It's not only in Saudi. And also we see how the expansions growing in those hospitals are basically very, very expensive. So this is impacting, of course, the quality of healthcare. Now, what we are showcasing here in Global Health this year is basically how the telemedicine solutions, the solutions that we are showing in critical care, in radiology, in cardiology, is basically can improve the access to care, can also overcome and help hospitals to continue providing healthcare with a very limited number of health practitioners, and also it is definitely impacting the patient experience. We see a lot of great projects that we have done in Saudi, whether it is in government sector or in private sector. We did a lot of great partnerships, a lot of first-of-kind projects around the globe, and also in Saudi in that context.
And any upcoming projects that we can talk about at this exhibition?
Absolutely. There is a lot of things that we can talk about. We continue our commitment in driving digital transformation in Saudi. We did a lot of great collaboration with a lot of hospitals when it comes to the first tele-ICU AI-enabled solution in Saudi, and also this is with other partners is getting scaled up. Also, we are talking about implementing the AI in radiology, implementing AI in tele-ICU as well. And now, for example, we are doing a couple of proof of concept with MOH in a very successful examples like last Hajj season by implementing the tele-ultrasound, which is basically something can help in reducing scan to time till less than 5 minutes, which is something is basically being supported by connecting the virtual hospital from Riyadh to the patient in Mecca at the spot. In less than 5 minutes they can get the report. So all of these are ongoing solutions, projects that we are working with government and private, and definitely this will continue scaling up better and bigger.
Lastly, another challenge usually tends to be adaptability. Are people accepting this change, and how have you seen the healthcare system evolve with the time and really accepting all of this technological innovations?
Absolutely, it's an issue everywhere when we are implementing a new technology. Of course, implementing all of these kind of solutions will not work without a proper change management. So change management, hospital management and sponsorship is basically very important to adopt this. Now, our always message to our customers and health practitioners is do not be afraid from using these kind of solutions, because at the end of the day it will not replace you, but it will be supporting you to take the decision, the right decision. It will increase the accuracy of diagnosis, and also it will give you a better experience when you are working.
Engineer Mohamed Sindi, thank you very, very much for joining us, and we look forward to seeing more innovations from Philips.
Absolutely, thank you. It was my pleasure. Thank you very much.